What does informed consent for escitalopram, otherwise known as Lexapro, look like? My name is Dr. Ruth Dutton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing when clinically appropriate. And I've been going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. So today we're talking about escitalopram, otherwise known as Lexapro, and this is one of our SSRIs, or selective serotonin reuptake inhibitors. So this class of medications is one of our most commonly prescribed psychiatric medications in psychiatry, and escitalopram or Lexapro is one of our most commonly prescribed SSRIs. So escitalopram is FDA approved for major depressive disorder as well as generalized anxiety in both adults and adolescents. However, it's also used off-label for a number of other conditions, things like eating disorders, OCD, panic disorder, PTSD. In terms of things that are unique to escitalopram, I usually think of this medication as a little bit more calming, so a lot of people prefer to take it at night. However, at the same time, I've definitely also had patients get really activated or agitated on this medication, so I think it totally depends on the individual. Side effects are going to be similar to those that can occur with any SSRI, so that includes things like headache, dizziness, stomach upset. We recommend taking this medication with food, drowsiness, fatigue. There can be sexual side effects. Usually these resolve once the medication is stopped, but sometimes they can persist after that. There's a slightly increased risk of bleeding. Sometimes there can be hyponatremia where your salt levels go low. We also counsel patients about the risk of SI as well as serotonin syndrome, especially when they're taking other serotonergic medications. Additionally, something that people have brought up a lot is that akathisia, which we typically think of as a side effect of antipsychotics, can also happen with the SSRIs. And that's an internal sense of restlessness, which can be really intense for some people. Other side effects can include things like increased sweating or changes in appetite or weight. One other thing about escitalopram that we counsel patients about is the risk of QTc prolongation, which basically means that it can change the way that your heart beats, which puts you at increased risk of a dangerous arrhythmia. So it's important to have an EKG on file if you're taking this medication. And if you're experiencing any palpitations, then you definitely need an EKG. Now, like all SSRIs, the longer you take this type of medication, the more challenging it can be to get off of. So I recommend a hyperbolic taper approach, meaning decreasing by a set percentage rather than a set milligram dosage with each dose reduction. And this should help to decrease the symptoms of acute withdrawal as well as to mitigate the risk of something called protracted withdrawal, which I've talked about in other videos, but it's a very unpleasant experience that can be life-threatening in some cases. So after talking about all this, we would talk about whether the potential benefits of this medication outweigh the risks for that individual, and we would make a shared decision from there. If there's another psychiatric medication that you want to hear me go through the informed consent process for, then please put it in the comments below. I'm also putting together an email list for those of you who are interested in my content because I may have future courses or resources or offerings, and I want to be able to communicate directly with you all about those things. So if that's you, send me a DM with your email, and I'll see you in the next one.